Hi Mac, this is Heidi, Trevor's physical therapist. I thought it would be easier just to do a video. There's just a couple things when I went through his program. I don't know how good of a historian he is in showing me exactly what exercises he's doing with you. So I totally get if these are way off base and it's just like a translation issue. But it seems like from what Trevor was telling me, you were doing some either sit-ups this way or reverse sit-ups like up like this, just because of my goals for physical therapy. I would rather strengthen the abdominals in a position where his spine's in neutral. So something like this could be the case where he's like, doing opposite arm and leg and coming up, opposite arm and leg and coming up. And then it would be harder to basically do one leg without the opposite arm and come up for the abdominals, and then both legs are even harder, obviously, progression like that. So also side planks are really good for him for abdominals because it's hard. He really struggled, and he's got a lateral shift in his spine, so coming up and doing a side plank is really difficult for him to keep that hip up. It tends to drop down. And so a progression of this could be holding this. If he can't do that, knees, and then he could do full plank and then progress to even foot off and holding that is a final progression. And then the last thing, I don't know if I can show this in the video, but I did a lot of hopping with him. And on left versus right, I think there's a difference in how far he can hop. So that would look like basically standing up like this on one leg and then seeing how far he can hop and stick it. I forget if there's a different side to side, but he would hop and then keep going. He couldn't stop himself when he hopped on one foot. And then triple hop is where you hop 3 times, 1, 2, 3, and stick it. So I'll try to demo that. So it's basically hop, 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 and sticking it. He couldn't stop after 3 hops. So you don't want to like hop, get balance, hop, get balance, hop. You want to do it hop, 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 and be able to control and stop that. So he really struggled with that, I think on the left and the right sides. So I just have some of those goals for him. And if you could work on some of that with him before I see him next, I think I'm going to see him in about a month from now. So he did really well with the split squat jumps when I saw him in PT a couple weeks ago. And I attribute that to everything you're doing with him. So thanks so much for working with him. I've seen a ton of improvement, and we'll keep moving forward. Thanks so much, Mac.